At first, thank you very much for the opportunity to give this case presentation. And I think it perfectly underscores what Janice just told us and teaches about the phenotype of Prader-Willi syndrome. It's a very brief presentation, so there will be enough room for the discussion. I chose a now 22-year-old male with PWS. He has an uniparental disomy. I know him for about 2 or 3 years now, but he had problems beginning at the age of 15, where he wasn't able to go to school anymore because of temper tantrums and outbursts, which got increasingly violent. The treatment at first was not treatment of the environment, but he received aripiprazole with no effect, and then chlorprothoxin, which at least sedated him, but didn't help him in any other way. At the age of 16, his coping skills were not effective anymore, and he was not able to go to school anymore. And besides having a very pronounced imagination ever since, he began talking about Michael Jackson, who would come to help him against the bad guys. He had delusions about relationships to other people, what was back then considered a psychosis. And he was treated with a lot of different antipsychotic medication, quetiapine, and he received lorazepam, pipamorelin, and left the clinic back then with clozapine and topiramate, which led to a massive weight gain. He was sleepy all day. He still had his temper outbursts, and it even required plastic surgery due to gynecomastia, which he suffered in the following years of treatment with clozapine. The current treatment is quetiapine 600 milligrams per day. We tried to get rid of all the antipsychotic drugs, but this wasn't possible due to his agitations, and he receives 25 milligrams of sertraline, which reduces the fierceness of his temper outbursts. I think important thing is that he still talks about his imaginary friends in rare occasions, especially when confronted with some sort of problem he isn't able to solve. And his verbal IQ is a lot higher than this other performance IQ, which is typical for people with PWS and UPD. So this is just the very key features of this patient. There's a lot more I could tell you about him. I could talk over an hour about him, but there's some questions I was asking myself, not only in this patient, but also in other patients. The one thing is, how does psychosis in PWS differ from, for instance, schizophrenic psychosis? Are we always dealing with real psychosis, or do we rather see an expression of an overload reaction? And what is the benefit of antipsychotic drugs in PWS associated psychosis? I think if you have other questions, just ask them, but that's the points I wanted to stimulate the discussion about this case presentation.